Hey everybody, how's everyone doing today? It's 3 o'clock, time for Talk with the Doc. I'm gonna wait a few moments, let some folks join in. Please invite your friends, all right? Just a few moments. Listen to these beautiful songs by Tank called Emergencies. We're gonna talk about emergencies today, all right? I don't own the rights to this music. Gonna wait one more moment, let some folks join in. Do you know what an emergency is? If you don't, you're gonna learn today. So join in, bring your friends, bring your questions. Hey, whoever just joined in, leave a comment so I know you're here so I can say hi. You know I like to start off with some music. Just calms things down a little bit. You never know what kind of day somebody's been having, right? Just a few more seconds. We're going to go ahead and get started. Love Tank, love Tank. All right, how's everybody doing today? It is Sunday, October 1st. It's already October, end of the year, guys, end of the year already. It is 3:04 p.m. Eastern Standard Time. Hey, Raven, how you doing? Good to see you. You all know who I am. I'm Dr. Nicole. I'm your board-certified family physician. I specialize in treating and preventing chronic medical conditions and educating people about those conditions in terms they understand. Through my concierge medical practice, my books, and my seminars, I help pastors and everyday people live their best lives by transforming their minds, their bodies, and their spirits so that they can have a greater impact on those around them, their children, their communities, and their congregations. please follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DrNicoledo. So, what are we going to talk about today? Well, like the song said, emergencies. So we're going to talk about the emergency. I did a video a couple of weeks ago, back when we were preparing for Hurricane Irma. And I talked about when people should go to the emergency room and how to not use the emergency room, when to not use the emergency room. And I said I would come back and give you a little bit more detail on that. So I'm back today to give you some details on when to use the emergency room and when not to use the emergency room. All right. So we all know what an ER is, an emergency room. The key word in an emergency room is emergency. All right. So we're going to discuss today what's an emergency and what's not an emergency. So basically, an emergency is any illness or injury that's life-threatening, that can potentially end or harm your life drastically. All right. So you need to know the first thing first is what is an emergency. So things like heart attacks, strokes, bleeding uncontrollably, like amputations, things like major head injuries, unconsciousness, choking, drowning, inability to breathe, chest pains, weakness, sudden symptoms, the worst headache of your life that comes on suddenly. These are things that are emergencies. So how do you know what's an emergency? Let me give you a little list of what I've kind of compiled as to when you need to either call 911, which is emergency medical services, to get an ambulance to you quickly so that you can be taken to an ER quickly, or to go to an ER immediately. If you have choking, if you stopped breathing or have trouble breathing, if you have a head injury with passing out or fainting or confusion, if there's an injury, of course, to the neck or the spine, if you feel like you can't move, like paralysis, if, of course, there's been any electrical shock, if you have a severe burn, if you have chest pain or chest pressure, if you have a seizure, if you have pain or weakness suddenly in the arm or the jaw, if you're not able to speak, you're not able to move, if you have dizziness or weakness that impairs your ability to stand or walk straight, if you have heavy bleeding, if you have a visible broken bone or suspected broken bone, if you are blood is leaving your body. So if you're coughing up blood, if you are having profuse or a lot of blood in the toilet from a bowel movement, or if you're urinating blood, if you have any high fever. A high fever would be a fever, I would say in the 103s or 104s, high fever. Then those could be reasons why you use an emergency room, because these can be emergencies. All right. These can be life-threatening. These can harm you drastically, and you need to get immediate, quick care so that we can figure out a diagnosis and know how to treat it. All right. So those are emergencies. Back when I used to do some rotations and work in the emergency room, you'd be surprised what people would come to the emergency room for. Maybe you wouldn't be surprised, but it would be some kind of ridiculous things. People would come for a cough or a cold. They would come because they ran out of their medicines. They would come because they wanted a pap smear. They would come because they were having, a vaginal discharge for 2 or 3 weeks. They would come for other screening things, minor things like I'm having some pain in my elbow. These little things were some reasons why people would come to the emergency room. Maybe A, they didn't know that that's not an emergency, or B, they couldn't go anywhere else to get care, but they came to an emergency room for things that were not an emergency. Now, when that does occur, I can tell you what will happen. What will happen is that you will have an incredibly long wait. And I've heard people complain about how many hours they've had to wait in an emergency room. Well, that's because you came to an emergency room for something that wasn't an emergency. All right. It may have been urgent, may have been important, may have been, a bother to you or bothersome, but it wasn't an emergency. So it's not like first come, first serve, like at a doctor's office or when you go to pay a bill, pay your water bill. It's not first come, first serve. So you might get there at 9 o'clock and wait until 12, 1 o'clock to be seen. Who's going to get seen first is the people that have the largest emergencies. It's called triage. That's spelled TRIAGE. It's called triage. So people that have the life-threatening emergencies, they're going to be the ones that are taken care of first. So that's why if you come to the emergency room for something that's not an emergency, you're going to sit and you're going to wait. And then you'll be complaining. And then you'll say that the care was poor because I had to wait for so many hours. Well, you kind of came to the emergency room for something that was an emergency. So you have to wait for they take care of the folks that do have the emergency. All right. So let me also let you know that the cost of going to the emergency room is very high. All right. So if you look at it from a cost-effective standpoint, going to the emergency room, of course, for something that is an emergency, you can't help that. You've got to go for that. But if you go to the emergency room because you have a cough or a cold, you're probably going to pay 3 times as much as you would have if you've gone to your regular doctor's office or to an urgent care. All right. 3 to 4 times as much sometimes. All right. So what is an urgent care? An urgent care is a facility that gives immediate medical care to people who are not having an emergency, but just have a medical issue. So some of the things that we typically see people come to the to the urgent care for are things like coughs, colds, sore throat, drainage from the eyes, ear pain, maybe muscle pains, headaches, aching somewhere, like, your elbow aches or you got a pain in your breast, stomach ache, nausea, vomiting, diarrhea, constipation, things like urinary symptoms like your UTIs, urinary tract infections, vaginal discharge, penile discharge, rashes, itching, poison ivy, poison oak, insect bites, sprained ankles, tendonitis in the elbow or in the joints, gout flare-ups. These are small medical problems that can be treated quickly in an urgent care setting. All right. So what are some of the pros of going to an urgent care? Well, you can get seen faster in an urgent care than you would in the emergency room. You also, it doesn't cost as much to go to an urgent care as it does to an ER. Okay. I can tell you, because I did used to work in an urgent care, I've seen lots of different things come through an urgent care. I even took care of somebody once who was having a heart attack, come through an urgent care. I think I took care of a stroke one time, come through an urgent care. I mean, this is like very apparent stroke, like face drooping, couldn't move one side, came into the urgent care instead of coming to the emergency room. Guys, if you're having an emergency, don't go to the urgent care, because all the urgent care can do is get you stabilized and wait for the EMS to come and pick you up and take you over to the ER where you should be. Okay, so you need to know the difference between emergencies and urgent appointments so that you can know where to go. Okay. Most urgent cares are open for extended hours. So a lot of them are open from, maybe 7 a.m. to 11 p.m. So they're open at the times, oftentimes, when a regular doctor's office is not open. Okay. So that's another pro of the urgent care, is that they have extended hours. Now, emergency rooms also are open 24/7. So if there's no place to get medical care, you can go to the emergency room. But like I said, if it's not an emergency, you probably will wait a long time. Hey, Dr. Crystal, thanks for joining in. So what is one of the cons of going to the urgent care? Well, with the urgent care, sometimes you don't know the doctor who's there, and oftentimes they don't know you. It's urgent. It's immediate. You're just kind of running in with the problem, and so you kind of have to go through your history. You got to go through all of your medications. You got to go through everything, and so that doctor won't necessarily have a relationship with you, and they don't know you. Okay, and there are some drawbacks from going to a doctor that doesn't know you. Versus if you're going to your primary doctor who knows you and has a relationship with you, they don't have to go through all of that information, the past medical history, the medication. They know all that information already, granted that you've already been established with that primary doctor. Okay. So, urgent care, the pros, like I said, it's faster care and you have some extended hours. One of the cons is that there's no continuity. So a lot of times you don't know the doctor and the doctor doesn't know you. All right. So the other thing that you can do when you're having any kind of problem, and like I said, that's coughs, colds, urinary tract infections, sprained ankle, any kind of medical problems, you can go to your primary care physician. That's what they're there for. They're there to treat everyone, their patients. And a lot of primary care physicians do have walk-in slots available. Those can fill up fairly quickly. So you can go to your primary doctor. You'd be surprised what kind of stuff your primary doctor can take care of as well. They can take care of rashes, UTIs, coughs and colds, even some minor major sprains. They can wrap them up for you. They can even do some casting in a primary care office. They can do staples, like if there's a large laceration. They can do suturing. They can do injections, joint injections. Primary care office can basically do just about everything. Okay. So what are one of the drawbacks to the primary care office? Well, a lot of times most primary care physicians have a patient panel of a couple thousand patients. And so some places it's difficult to get in to see the doctor. So it can take sometimes, a couple of days, if not a week, to get an appointment with your doctor if they don't have any walk-in slots available. So, the primary care physician has limited time. You can only see them at the times that they're open. So whether that's 9 to 5 or, 8 to 4, 7 to 3, whatever those usually 8 hours or maybe sometimes 10 hours stretch of time, that's when you have to see your primary doctor. Most offices, if you call, there is someone on call, but they're not going to necessarily give you medical care other than letting you know if it's something that you can wait until morning or letting you know if you need to go to the emergency room. All right. So that's kind of the three areas, the three types of medical care that you can receive when you are ill. You can an emergency room, which is for emergencies. All right. Life-threatening emergencies. There's the urgent care, which is for pretty much just about anything, except for emergencies, not for emergencies. And then there's the primary doctor office, which is also pretty much for anything except for the major emergencies. All right. Again, the con to the emergency room is that if you're not having a life-threatening emergency, you will wait a very long time because they have to take care of the large emergencies first. And if one of the pros of the emergency room, though, is that it is open 24/7. All right. Urgent care often has extended hours so that you can get seen a little bit longer or more than a primary care office. But that's not for emergencies, and there's lack of continuity a lot of times. Okay. And then your primary care office, the pro, of course, is that you have the continuity. You know your physician. They know what's going on with you. You know about them, but they do have limited hours for only the hours that they're open. Okay. So what are some other options? Now that there are some new primary care offices that are out called direct patient care. And with direct patient care, these patients often pay a monthly, what's called a retainer fee, to be part of these practices. And these practices have less patients. So when they have less patients, they have more time that they can devote to each patient. And then you also get 24/7 access to your doctor, whether that's through telephone, whether that's through text message, whether that's through a portal, whether that's through telemedicine. But the direct primary care offices have 24/7 access to your doctor. And to get access to that, you pay your monthly fee. And then most of the time you can have an unlimited amount of doctor's visits. So you can come in for your maintenance things like, refills on your blood pressure medicines, refills on your diabetes medicine, a checkup, a sports physical, all of these things. But you can also come in for the urgent visits as well. And then if you have a problem, let's say at 11 p.m. at night or midnight, you can still contact the doctor and you will get a response because you're paying for that access. All right. One more type of medical practice that's out now is called concierge medicine. Concierge medicine is a lot like the direct primary care in the fact that you have 24/7 access to your doctor, but with the concierge medicine, it's more personalized, and it is directed at the convenience of the patient. So a lot of times that means that the doctor will come to the patient, or that they can get in touch with the patient 24/7. So that's either through text message, through direct telephone calls, through telemedicine portals. But a lot of times with the concierge medicine, that is medical care brought to you at your location. All right. So again, you pay for the convenience. So those are the different types of medical practices. And I hope I've shed some light today on what an emergency is, when you need to go to an emergency room versus an urgent care, and then some other options. Also, like I said, your primary care office, or if you want to join a direct patient care office, or even have concierge medicine. I just wanted to tell you one other. When working in an emergency room, you're not going to get screening things. So screening, let me just explain this real quick. Screening is things like a pap smear, your breast exams, your prostate checks. You're not going to get those in an emergency room, and might not get those in an urgent care as well. Urgent care and the emergency rooms are going to take care of more of the problem visit. So if you're having a vaginal discharge, they're going to do a swab and take a look at it, but they're not going to do a pap smear. And if you want more information on the difference between a pap smear and a vaginal exam, please look up my video on the HAPs on PAPs, and I explain to you what the difference is. A pap smear is a screening exam for cervical cancer versus a pelvic exam, which is looking for a problem in the vagina or in the groin. All right, so there is a difference there. So like I said, at the emergency room, you're not going to get a pap smear. I hear patients tell me that all the time. Oh, I got a pap at the ER. No, you didn't. You got a pelvic exam, but you didn't get a pap. Okay. Also, filling your chronic medications, like let's say you're out of your high blood pressure medicine. I've seen that happen in the emergency room. People go and they try and get refill on their medicine, and they wait hours sometimes to get that refill. It's not worth it. Okay. You need to be established with your doctor and have a doctor's office that you can call to get your refills on your medications. All right. Or you can go to an urgent care sometimes, and they'll give you a short supply prescription to hold you over until you're able to get back in to see your primary care physician. And then again, if you get in with one of these direct patient care programs or with concierge medicine, you have 24/7 access to your doctor, and you're able to call, let's say, if you need them in the middle of the night, or if you forgot your medication, to fill your medication on time. All right. So that's just some information on emergencies, emergency rooms versus urgent cares versus primary care physician offices, and what each one does. All right. I hope you guys learned a lot today and that you've learned something. Again, I'm Dr. Nicole, your board certified family physician. I help treat and I help people prevent chronic medical conditions, and I explain those conditions in terms that people can understand on my weekly Talk with the Doc session. I thank you for joining me today. So through my books, my seminars, and my concierge medical practice, which is just open, Abundant Life Concierge, I help pastors and congregations and everyday people live their best lives by transforming their mind, body, and spirit, so that they can have a greater impact on those around them, their congregations, their children, their communities, and everybody around them. All right. Thank you for joining me today. Like I said, I did just recently start my own concierge medical practice. If you'd like some more information on what concierge medicine is, you can contact Abundant Life Concierge, and the phone number will be listed on in the comments, but it is 803-543-2913 if you'd like to call and get some more information on what concierge medicine is and how it can work for you. Right now, I am seeing pastors and helping them when they don't have a lot of time. So when their time is stretched and they don't have time to get to a doctor's office, I, being the concierge doctor, can come to them. So if you'd like more information on that, please contact me. And you can also book my services right here on Facebook. All right. Thanks so much again for following me today. And we will see you back later on. This week, I will do one more Facebook Live this week on what is concierge medicine. And I will, of course, see you next Sunday at 3:00 p.m. Eastern Standard Time for our weekly Talk with the Doc session. Thank you so much. Have a great day. Bye-bye.